together on these passages. So how did everyone find this passage? Easy, medium, difficult? Okay, that's good. So I only really highlighted 3 things since the passage is so short. I highlighted the goal of the study and the variables. When you are highlighting passages, you should highlight key terms, purposes of studies, variables, locations. I'll get more into this later. And by locations, I mean like body parts. All right, so would anyone like to volunteer their answer for question 1? Okay, so the correct answer for this question is actually A. This question was more of a fact that you have to know about the anatomy. The MCAT does require you to know the different types of muscles and their functions. So the lungs naturally want to recoil. To stop this from happening, it has to be attached to the ribs. And this is where the intercostal muscles come to play. They attach the lungs to the ribs so that the lungs won't collapse. And for those of you who probably thought the answer was C at first, I can see why you would think that. The diaphragm is located underneath the lungs, but its role is to help create a vacuum so that when you're inhaling, it can pull air into the lungs. It doesn't actually stop it from collapsing. Abdominal muscles also aren't really involved in breathing or preventing lung collapse, and the deltoid is like nowhere, not really near the lungs. So any questions about this? I hope the diagram helped to like visualize the anatomy a bit. Okay, so for this question, any volunteers? Yeah, the correct answer is A. And how did you come to that answer?
I thought that hypoventilation is the opposite of hyperventilation, so that's how I thought of it.
Yeah, so hypoventilation means a decrease in respiratory rate, meaning that less oxygen is inhaled and less CO2 is exhaled. So your blood would have lower PO2 and will have a higher PCO2. Hyperventilation is the opposite. So it would cause a decrease in PCO2 because more CO2 is released from the blood. All right. And for question 3, was this problem a little bit too challenging? Yeah, so Brian, why do you say it was C?
Because they were using the pressure gradient will go from a higher pressure to lower pressure. And when you're breathing in, you want to induce the air inside of your lung. And when you're breathing out, you want to force the pressure gradient to getting out of your lung. So they should be greater when breathing out.
Yes, perfect. So when you are inhaling, the alveolar pressure inside your lungs is lower than the atmospheric pressure. So that is what allows inhalation in the first place. So once you inhale and the pressure in the alveoli increases, you will exhale because the alveolar pressure is now greater than the atmospheric pressure. All right, so question 4, any volunteers for this one? So physiologically, that causes these pressure changes. There's like a lot of factors that come into what causes the pressure changes. So it's the alveolar volume, it's the lung volume that changes, the diaphragm becoming that like dome shape so that you could exhale. It's a lot to explain right now. I think Pranava explained this in her topic session. The important thing is that it's not just one thing that causes these pressure changes, it's a whole like concert of things. Okay, so for this question, did anyone have an answer for this one? All right, so this question also kind of got to me. So A is wrong because after you've eaten a large meal, the abdominal cavity will contain more contents. So the diaphragm will not contract as easily, which makes expansion harder. So it would prevent expansion of the thoracic cavity. So we can eliminate A, and C is similar to A because during the third trimester of pregnancy, your abdomen is large and it forces the contents, sorry, the uterus is large and forces the contents in the abdomen to move upwards. So the diaphragm can't contract as easily. And D is also incorrect because if the diaphragm nerves were cut off, it would be unable to contract in the first place. So by process of elimination, we are left with B. All right, so a decrease in lung elasticity will make expansion of the chest easier because lung elasticity tends to bring the chest inwards. Elasticity in its most basic definition means the ability of an object to return to its normal shape after being stretched or compressed. A pair of lungs with low elasticity can stretch just fine. So when you're exhaling, it just won't return back to its normal shape, like in this diagram. So decreasing lung elasticity won't actually prevent expansion of the thoracic cavity. So again, to be quite honest with you, I wasn't entirely confident with the answer choice B, but eliminating A and C, which are similar to each other, and D will help answer like this type of question. And sometimes you'll come across questions like this on the MCAT. Does that make sense?
I have a question.
Yeah.
If decrease the lung elasticity, would it become harder to open up the lung and expand the volume of lung? Since it's like if you change the rubber ball to a harder rubber ball, that would be not easily to expand as before.
Yeah, so that's what I thought. I had the exact same thought process, but after doing extensive research, I learned that you have to think of this question in terms of elasticity, meaning the ability of the object to recoil to its normal shape. So that's the only thing that matters. So lungs having a lower elasticity would mean that it just wouldn't be able to go back into its normal shape. So it can stretch just fine, it can exhale, it can expand the thoracic cavity normally, it just won't recoil normally. Does that make sense?
Yes, thank you. I was confused with the definition.
I know, I was confused as well. All right, and for this question? All right, Yeah, so the answer is A. Can anyone tell me why? Yeah, exactly. So the graph is showing an inverse relationship between volume of inspiration and respiratory rate. So A would be our answer. A high volume of inspiration would mean a low respiratory rate and vice versa. So choice B and C are not correct. You can't really conclude that based on just the figure alone. And D is wrong because the graph is showing this negative slope. All right. Does anyone have any questions before we move on to the second passage? Okay, and with that, I will pass it over to Sim.
Okay, what did you guys think of this passage? So, number one. Yep, so we're looking for the vertical component. Eric, do you want to say how you found that?
Hi, sure. This one I mostly memorized, so I just drew out the horizontal and vertical component of that initial velocity, and I just used the basic SOHCAHTOA, and sine 30 was the resultant for that.
Yeah, perfect. Thank you. Yeah, so like Eric mentioned that in the vertical component, this is something you should know that sine theta is for the vertical and horizontal is cosine theta. And we would just match up the launch trial to speed and get the degrees. So does anyone have any questions? Okay, thank you for that explanation. What about number two? Did no one do number two? Okay. So here we had to look at the data in the table, and looking at that, we could look at trials that kept the speed constant but changed the angles. So I looked at trials 2 and 4 where the speed was the same, but the angles increased. And looking at that distance, the distance also increased from 141 to 161. So increasing that angle also increased the distance. Does that make sense? I can also show you on the table itself. So I compared launch number 2 and 4 because the speeds were the same, but the angles increased. And then you can see the distance also increased here. You could also have done this with launch number 1, 3, and 5. As the angle increased from 30, 40, 45, the distance also increased from 35 to 40 to 41. Okay, number 3. So what was the largest horizontal component of velocity? Yeah, Amal, do you want to explain why?
It was kind of like earlier using like SOHCAHTOA.
Yeah. So looking at the horizontal, that's going to, oh, did I not include the, oh yeah, here it is. So the horizontal component is cosine, and I guess in all of these answers it's just cosine. You're just looking at the degree. So in cosine, as the degree increases, the number actually decreases. So a larger angle will have a smaller value. So we want to choose theta that is the smallest. So we can cross off C and D, and just 40 is a bigger number than 20, so B will be greater. Yeah, and I definitely think you guys should memorize these. Know that like what sine of 0 and the degrees all the way from 0 to 90 are for sine and cosine. These are like the rounded numbers, and these are really helpful to know for the MCAT. Okay, number 4. So we're comparing the total horizontal displacement and the vertical displacement. What do you guys think? Okay, yeah, so this is kind of tricky, but the answer is A. So actually the formula would give you the same number because we, for the 5th medical pack, I believe that the angle was the same and the distance, and the degree was also the same. So that would give you the same number, but since we're looking at displacement, the vertical displacement as it's going up and it's going to land back down at the same height. So the displacement is actually 0 for vertical, and it will have a greater horizontal displacement. Let me know if that makes sense. Okay, perfect. Number 5. Yeah, so this was just kind of guesstimating. So I compared the launch distance at 20 and 40. So at 20, it was 40 the distance, and at 40, the launch distance was 161. And as you can see, it increases quite a bit just from 20 to 40. And then so around 30, it should be, if it's increasing from 40 to 161, it should definitely be somewhere in the middle with a large increase. So 90 would be the best bet here. Does that make sense? Okay, perfect. And if you guys don't have any questions, we're going to send the next 2 passages that you will do, and yep, we'll give you 20 minutes to do those. Ashley, do you want to send your passage?
Yes, 1 second. My internet is not good right now.
Oh, no worries. You guys can go ahead and get started on that passage that I sent, and Ashley will send the other one out shortly. So you'll have 20 minutes to do both of them. Hey guys, there's a minute left, so let us know if you're done or if you need another 1 or 2 minutes.
Okay, time is up. So how did everyone find this passage? Easy, medium, hard? Easy? Okay. All right, so I'll show you what I highlighted. So as you can see, my highlights are very minimal. Can anyone tell me why I would do that? Yes, there's a lot of information in this passage, so I only highlighted what's important. You may ask, but everything is important. And while that's true, you only need to highlight defining terms that will probably be asked of you in the questions. So I first started with arteries. Atherosclerosis only occurs in the arteries, not the capillaries, not the veins, just the arteries. Next, the second passage is talking about what happens when there's a plaque in the coronary artery. This is very specific and tells us where the following events are happening. The initial warning sign occurs only during exercise. All right, so very specific again. And myocardial infarction only occurs when blood flow is restricted to the heart tissue. The passage is giving me that specific cause. So now the passage is telling me about these thrombolytic drugs. The only thing I need to know about them is that they are given when someone is experiencing a myocardial infarction, which I'm going to say MI from now on. All right, any questions about my highlights? All right. So for this question, any volunteers? Why is the answer A? Exactly. So the passage says that atherosclerotic plaques, oh my God, I'm so sorry, build up slowly over time, often without noticeable clinical signs. B is actually true. The passage states that plaques are developed first in the arteries, which prevent the flow of blood to the rest of the body. The passage also states that an initial warning sign of atherosclerosis is chest pain, which is noticed during exercise. It doesn't state that exercise causes atherosclerosis. So D is also true because it's used as a treatment when someone is having MI, also known as a heart attack. This medication is used to dissolve the thrombus / blood clot in coronary arteries and restores blood flow. So it's not used to treat atherosclerosis or reverse it. Right. Question 2. Any volunteers? All right, so the correct answer is C. Would anyone like to tell me why? Yes. So antidiuretic hormone, ADH, is a hormone that causes water retention and is released by the posterior pituitary. Let me slip this in while I'm at it. You do have to know your hormones, what effects they bring, and where they're produced. All right, so to answer this question, you need to know that cardiac output is equal to heart rate multiplied by stroke volume. This is an equation you need to have memorized. To minimize cardiac output, you would have to decrease heart rate and stroke volume. To decrease stroke volume, your body would need to secrete less ADH, so there is less total blood volume. To decrease heart rate, the vagus nerve would have to be stimulated. If you recall, the vagus nerve is responsible for the rest and digest process. It decreases heart rate and the force of contraction.
Sorry, would you mind repeating that explanation again?
Yes, so ADH, antidiuretic hormone, is responsible for increasing water retention. So your blood volume will increase. The question is asking you which of the following will decrease cardiac output. To decrease cardiac output, you would have to reduce heart rate and stroke volume. So since ADH causes an increase in blood volume, you would want less of ADH. So A and B are out. Next, stimulation or inhibition of the vagus nerve. The vagus nerve is responsible for the rest and digest process. The vagus nerve decreases heart rate and the force of contraction. So you would want to activate the vagus nerve so that the heart rate will reduce. And since you have a now reduced heart rate and reduced stroke volume, you will now have a decreased cardiac output. Does that make sense? Okay. And for this question? Why do you say C? Or sorry, A? Right. So for the MCAT, you won't have a labeled diagram of the heart. So you do need to know the basic anatomy. To answer this question, you need to understand that the aorta connects to the left ventricle. When the left ventricle contracts, it forces blood into the aorta. And if blood pressure in the aorta is low, that means that the left ventricle didn't propel the blood hard enough. And this is most likely caused by the chronic ischemia mentioned in the question. The answer is not D, the left atrium, because the left ventricle is responsible for pushing the blood into the aorta. That's why it's surrounded by more muscle. The answer also isn't B, the SA node, because if it were, then the blood pressure in the aorta and pulmonary circulation would be lower. Question 4. Any volunteers? Okay, why do you say B?
I said B because it's an anticoagulant, thrombolytic drugs, and so if you have hemophilia, that would be, it would make it worse.
Yeah, exactly. So the passage states that thrombolytic drugs work by dissolving the thrombus/blood clot typically seen in heart attacks. So A and D are out. Platelets are important components of blood because they are responsible for clotting. A person with elevated platelets may use thrombolytic drugs to prevent clots from occurring since they are predisposed to these clots. So that leaves us with B. Hemophilia, it's a genetic disorder in which a person's blood cannot clot properly, and it puts them at risk of bleeding out. It would be dangerous for this person to take thrombolytic drugs because they already can't form clots, so it would be making their disorder worse. Okay, that's good that you got that clarification. All right. And for question 5? All right, why are you guys saying C?
I wasn't sure about this, but I said C because I think that the atrial parts of the heart and then the ventricles contract together.
Okay, so you are correct, but the answer is actually D. If we look at this diagram, the SA node is located in the right atrium and causes atrial contraction. Its signal spreads to the AV node, which will spread the signal further to the left and right bundle branches. So the question is telling you that the person has a left bundle branch block. Like I said, action potential starts at the SA node, so B is out of the picture. A is also out because the SA node causes atrial contraction before ventricular contraction, so that the blood can be pushed into the ventricles. So A is out. C occurs in a normal person. The ventricles would be contracting simultaneously, but D is more appropriate for this question because the person has a left bundled branch block, meaning that the left ventricle will contract later than it's supposed to. So the right ventricle will contract before the left ventricle does. Does that make sense? So the keywords here are left bundle branch block. So the answer is not B because for the contraction of the heart, that starts with the SA node in the right atrium. So this is where action potential starts. Then it's transmitted to the AV node. So atrial contraction. So the reason that B is incorrect is because it starts with atrial contraction, but SA node causes this atrial contraction. Yeah, so the answer would be C without the block. All right. Any volunteers for this one? Okay, why do you say B? Okay, so the key word to this question is ischemic. Can anyone tell me what ischemia means? Right, so ischemia means there is a lack of blood flow and oxygen delivery to a part of the body, which causes cell death. Ischemic necrosis is therefore most similar to D, myocardial infarction. So the passage states that MI is death of heart muscle tissue due to restricted blood flow to a particular segment of heart tissue. Foam cells are formed in the beginning of atherosclerosis, and the passage does not mention that it involves tissue death. A coronary thrombus is also incorrect because that just means a blood clot. It doesn't necessarily mean tissue death. It's just something that can cause MI, which causes tissue death. And angina pectoris just means chest pain, which is a warning sign of atherosclerosis. Again, it doesn't involve tissue death. Does that make sense? So according to the passage, MI is caused by the lack of blood flow to a segment of heart tissue. What causes that blood flow could have several different factors, but MI is caused by that restricted blood flow.
Can you say the reason is not B is because the blockage does not necessarily lead to the failure of the heart muscle?
Right.
Okay.
Right. Yeah,
I got
it's
it,
just
thank you.
something. Okay.
It's just something that is a condition, but not necessarily cause the disease similar to this medical condition.
Exactly. So in this question, gangrene would be most similar to MI because both involve cell death.
Okay, thank you.
No problem. Any more questions before we move on to the other passage? All right. Oh, we're already at 2 o'clock. Sorry for taking forever.
No worries. What did you guys think of this passage? So this was like a basic physics passage, and we'll go over these now. So what did you guys get for number 1? Yep, D. So this is basically plugging in those formulas. The potential energy will be equal to the kinetic energy. So we plug in mgh is equal to 1/2 mv squared, and velocity is equal to square root of 2gh. And just plugging in those numbers, we are going to get around something like 16. Does that make sense? Okay, what about number 2? Okay, so here we want to decrease the amount the spring gets compressed. So if we make the ramp taller, it would have less kinetic energy and more potential energy. And that would actually decrease the compression. Does that make sense? So B would be the best answer here to decrease the amount that the spring actually gets compressed. Okay, what about number 3? Okay, so for sake of time, I'm just going to go over these, but so for the gravitational potential energy, the total change would be the final minus initial, and we would plug in the same formula that we used for potential energy using mgh, and just plugging these numbers in, we would get around negative 41,000 joules. Does that make sense? Okay. So what is happening to the kinetic energy and the potential energy of the cart and the spring potential energy when the spring is compressed? So what happens here is that the kinetic energy is going to be decreasing because of speed is decreasing. And then the potential energy of the gravity is actually constant because we're at the same height. And the spring potential energy is increasing because we are compressing the spring now. Does that make sense? Okay, last question. So how much will the spring be compressed once the ride stops? So here we plug in the spring formula, which is 1/2 kx squared, and we match that up with the kinetic energy formula and we solve for x. And just plugging in those numbers, I kind of guesstimated, and it's going to be around 7 and 8, and 7.9 would be the best answer here. Does that make sense? Okay, perfect. So if anyone doesn't have any questions, thank you so much for coming to this session today. And if you have any questions, feel free to reach us at our email, mcat101questions@gmail.com. And we'll send out the post-session email. And yeah, thank you so much for coming. Ashley, do you have any other feedback?
Yes, also so our website is mcat101.godaddy.com for now. You can make an account there and you could also view the past recorded sessions just to make it easier.
Okay, thank you.